Good evening and welcome to tonight's Health and Social Care Scrutiny meeting.
They just okay, that's yeah, that's that.
My name is Councillor Susanna Bacho and I'm the chair of the commission. Before we start the meeting, I have a few housekeeping announcements to make. There are no planned fire alarms tonight. If you hear the fire, please make your way to the nearest fire exit and make your way to the agreed assemble point, which is St. John's Courtyard of Drew Street. Council security staffs will be available to direct you. The public toilets are located on the main reception area. Please switch your mobile phones to silent while the meeting is on in the room. The meeting is being live streamed by Southwark Council YouTube channel. A recording of the meeting will be viewable on the YouTube after the meeting has ended. May I remind members to raise their hands if they wish to speak, and please wait until I give them permission to speak before contributing. Members of the public are welcome to screenshot or Twitter the public procedures of the meeting. A copy of the council protocol for reporting and filming is available on the website. Apologies. Pre-apologies. Ali, Sally Smith, and Councillor. Application of any other business deemed or there are no late or disclosure of interest and dispensation. Any member wish to declare any interest or dispensation? Thank you. We now move to the minutes of the last meeting. I'm going to take you page by page, which is on the opening agenda. We have page 1, we have page 2, page 3, page 4, page 5, page 6, and page 7. Can we agree these minutes, please? We're now moving to our next item, which is item 5, cancer prevention and early diagnosis.
Yes. So mention to the supplementary agenda. Has everybody got a copy? Yeah. So this has got the headline report, cancer prevention and early diagnosis. So it's building on the headline report that we and in recent cancer prevention last meeting, and so that is summarised page from section, which is starting page actually 25. Yeah. So that gives you a summary. All the topics that were discussed. So there was vaccination, smoking cessation outreach, public health campaign, environmental risk, reduction and cervical cancer and this. And then recommendations. So the recommendations have been substantially same as in April, but they've been further refined. They take on advice that we had Nancy Couchman, who suggested that we out the model primary care, and also it's got the last recommendation is regarding the discussion that we had about PM and cervical screening. So that's to have a trauma be sensitive to women who cervical cancer screen. So those are all the recommendations. And I've also sent it to the relevant office, send any comments. And then so the next step is for you as a commission to, if you'd like to make any changes or any amendments, and then at the next meeting to do a final report.
Take us back. I did forget how the members to council Council, the chair.
Councillor Maria Limpo.
Councillor Sandra Rule, Nunhead and Queens Road, member of Social Care Scrutiny.
And I'm Julie Timbrell, and I'm the
Thank you. Okay.
Thank you, Chair. I do have some questions. First of all, do we know why Southwark is still significantly below the national early diagnosis? What is being done to close the gap? So that's one of the questions. If I go through all the questions, then we can find out. Well, either we can add these questions for the next meeting or whatever. How is the effectiveness of unconventional outreach methods being measured? How is the effectiveness of unconventional outreach methods being measured? Are they cost effective? What trauma-informed support is available for women affected with FGM? Is this being integrated into cervical screening services? Why has the EPIC system not been fully utilized to improve data capture and service design? How are vulnerable groups, such as those on 0-hour contracts or with mental health conditions, being supported to access the screening? Those are my questions. And either we can just put these questions, which I can send them to you for the next meeting, or just so that we can revise the report or whatever. Thank you, Chair.
Thank you, Councillor Maria. We will.
I had, Chair, that I did send that around to officers, and they did send some updated information on early diagnosis, which shows an improvement. So I would suggest I can send that around to everybody, and I suggest that we include that in the report.
Then I will answer back to you to questions. Yeah. Okay.
Is to send those around. We can consider those between us, and then where it looks like it would be better to send to officers, like them to send them further information. Yeah.
Thank you so much.
Would you be able to email me those? Sorry? Would you be able to email me so I've got a really clear?
I will email them to you tomorrow.
Thank you.
Thank you. We now move to item 6, which is the Cabinet's report to the nursing care home delivery scrutiny review reports. So this report is just for you to note. And item 7 is the nursing care home base standard, a paper setting out scrutiny research on best practices. Includes members have any comments on this? Okay, we now move up to work program 8. Okay, we're going to move item 8 to the end of the work program. It's the work program, so we're going to move it to the end of item 9. So we now do item 9, which is the asylum road care home. And what I will do is I will give you a breakdown of what has occurred and then we can decide on how we go on. I would like to begin by acknowledging the Cabinet's response to the Commission concern regarding the delivery of the asylum home care. We noted and welcomed three of the recommendations were taken on board. Our role as scrutiny is not to obstruct, but to ensure the Council acts transparently, demonstrates good governing, and in the long term interest of Southwark's residents. These were the three additional amendments Cabinet made. One, noted that future feedbacks from the Health and Social Care Scrutiny Commission meets scheduled for Thursday, 16 October 2025, would be taken in accounting during the lease negotiation stage with the handover. Two, noted that the planning and growth would explore options for appointing the Dementia Service Development Center at the University of Stirling as sectors specified to comment on the proposed design at the appropriate time. And three, notes that which refer to the paragraph 23 of the open report of the Andover's nursing home has now been rated good by the CQC, 4th September 2025. I will now invite Scrutiny Project Manager to explain how this will be dealt with.
Yeah, thank you, Chair. So, on the advice of the monitoring officer, this item will be deferred to a later meeting. That's to allow the cabinet member to go through the process so it's actually been implemented, which will only happen after the call-in process has completed. And so this item will be taken up.
Agreed by the rest of the. Thank you. We now move on to agenda item 8, which is the work program. Oh, sorry. Yeah, it's work program. So I'm going to call on Julie to run us through the work program, and then any feedbacks you have.
Yes, so thanks, Chair. So the work programme is set out on pages 37 and 46. So I think the best place to start is page 42. So the items for the Monday, the 1st of December are Blue Badge, improving access to toilets, Southwark annual report presentation, the hoarding officer report, and the final scrutiny review report on cancer prevention and early diagnosis. And I think bearing in mind that you're deferring this item, the asylum road care homes, you may wish to consider putting in another meeting before the 1st of December once the decision-making process on that.
Yes, we will be doing.
And I would suggest that you may also want to take the nursing care home space standards if officers are in a position to provide a report on that, and probably the hoarding paper as well. So that would probably make good enough meeting, I think, in terms of essential items.
Yes.
Yeah.
I'd like to tell you now that I've come to the end of the meeting for today. Thank you all for attending.
Thank you, Chair.